If you look at Service New South Wales and its journey, it's really transformed the whole customer experience end to end. If you look at our success, it hasn't been on technology, it hasn't been great process. Success has come down to people and the way that our people have interacted with our customers. But ultimately, that all comes down to people-centred culture. And we really base everything on what we call the service design model, which is, in effect, in very simple terms, good process, good design, happy staff equals great customer experience and happy customers.
We talk in health about patient-centred care, but I think increasingly we're understanding this is not just about centering our care around patients, but also around the people who work with patients. We know that our staff need to be supported, nourished, cherished, rewarded, so that they can then in turn care for the patients. We cannot provide effective patient care if we don't support our staff.
Everything that we've done from the beginning with Service New South Wales has been designed by customers and our staff, who are closest to our customers and, as you say, who are also our customers. The way that we do that is through human-centred design as one key element, but the other thing is about feedback. We get feedback from our staff and we get feedback from our customers. The two of those things together gives us a really rich sense of the things that we're doing well and the things that we need to improve on. And that cycle of continuous improvement has been critical to our success.
We've spent a lot of time writing patient safety programs and developing ways of improving care for patients. Increasingly, we're focusing on what is the culture of the organisation and how does that support the staff to provide good patient-centred care. And I'm a real believer in measuring what matters, so we're increasingly asking the question of both staff and patients, what matters to you, and then measuring our performance based on what really matters.
I think the key thing to any role, whether you're a health professional, a police officer or a CSR in Service New South Wales, it's about being authentic and being genuine and bringing your whole self to work. You expect that of somebody who's serving you, but you also want to be able to bring your whole self to work and enjoy the work that you're doing.
We hear a lot about we're fatigued about just another thing. I think we need to step back, start working with the people who provide care to the patient on the front line and talk about what out of what you're being asked to do is actually important. What could you stop doing? And what could you reinvest your time in to make sure that both your staff and also your patients have the best experience of the care provision?
I think that the key message is back yourself. So many times women think, can I really do this? And that little voice in their head just jumps in and gives a bit of doubt. Back yourself, because most of the time females get it, they know what they need to do, but there's this little voice that tells them they can't do it. So my key message is back yourself, and it's okay to think that you don't know everything and wing it a little bit because everybody else does.